Hi, I am going to talk a little bit about trauma. I'm going to talk about a specific client that has experienced trauma, what type of trauma, and some of the interventions that could be used to be effective with a client who has dealt with this type of trauma. The client that I have selected is a 49-year-old male, Caucasian male. The client has come to treatment. He is in need of drug and alcohol treatment. He has never been in treatment before. The client came to us with a history of beginning drinking alcohol at the age of approximately 6 or 7 years old. At his very most, which was just recently when he came to us, was drinking about 40 to 50 beers a day. The client stated that he no longer felt like he was drunk or intoxicated, and which made him continue to drink more and more. After heavy evaluation with the client, it was found that the client had experienced extreme trauma starting at the age of a small child within the home. The client was witness to his mother getting daily beatings from physical, mental, emotional abuse from his father, along with his 7 other brothers and sisters. There was severe sexual trauma. The client was the oldest in the household, and the father would physically and sexually abuse the children. He, according to the client, prided himself on not penetrating the children, but touching them inappropriately and having the other children watch. According to the client, this is how his father was able to obtain pleasure, was having the other children watch him abuse his siblings. The client's mother was so severely abused that she was placed in an entire body cast because of her beatings. And when his father, who was a severe alcoholic, came home, some chore was not done, and he physically picked up his mother and threw her in a fire. And because she was in a body cast, was unable to get out of the fire, so small children had to somehow get her out of the active fire. So the client has experienced severe trauma and has never been in any type of therapy or treatment before, and used alcohol to numb or to avoid any of those issues. So I'm going to be meeting with James to discuss just letting him know what trauma is, what are some of the feelings that he's feeling, and then also some of the interventions that can be used so that he can work through this trauma in his life. So I'm going to begin the session with James. Hi James. I wanted to welcome you to my office. I appreciate you coming in and letting me sit down and talk to you. I just want to let you know that everything kind of in this office and in this place is safe for you. I want you to feel comfortable being able to be open and honest. There's no judgment here. And at any time, if you feel uncomfortable, if you need a break, I want you to feel comfortable getting up and leaving the room, or just saying, hey, Mike, I need a break, I need to step out. I want you to feel safe and comfortable, and at no time do I not want you to communicate any of that to me. Please let me know. So I want to first talk about what trauma is. You've briefly kind of let me know what the trauma that you experienced was, and when you first got here, you kind of let us know that you didn't know really what trauma was, or you just knew that bad things happened to you and your family. So I want to let you know that your excessive drinking is definitely a result of the traumatic events that have happened to you. Absolutely none of what happened to you was your fault or anyone in your family. and that, your expression of your feelings hasn't been able to be supported and guided because you haven't really been able to get any type of treatment. So, a traumatic event that happens to somebody is something so harmful or hurtful to their psyche, emotional, physical, mental, that it can really place this stamp on their psyche and really be detrimental to them. They can't process in a normal way where some other people would be able to cope with the loss of a loved one, or getting harmed by getting a cut or some sort. And it seems like what's happened, James, is that at a very young age, you learn to cope with the abuse that your father endured on you with your excessive drinking at a very young age. I mean, it looks like you started drinking at about 6 or 7. So being able to understand that drinking was associated to the trauma that you endured and the feelings that you felt, and not being able to express or cope with those feelings is what kind of built up in your mind and your body to the point where you weren't able to kind of let those feelings out. So what I'd like to talk about is some of the different therapies that would be beneficial for you. I do believe that you've experienced a great deal of PTSD. You've let us know that you have constant nightmares and flashbacks because of the treatment and the trauma that you received at the hands of your father. So there is a type of therapeutic intervention called EMDR. And EMDR is eye movement desensitization and reprocessing. And what that is that it takes your rapid eye movement when you're in a session, and it actually allows you to kind of process some of those negative feelings and emotions and flashbacks and memories and reprocess them. So EMDR has 8 phases. Within those 8 phases, there's 3 time periods that are going to be talked about: past, present, and future. The whole point of EMDR is to empower the client. In just your normal sessions with myself or the other therapists that you've worked with, it's a lot of us kind of trying to pry out some of those things and us working on those things. With EMDR, you're really doing all the work. It's a lot less talking, because I know, James, you don't really like to talk about how things really went and some of the feelings in detail, but so it's a lot less talking and more with your mind, your body and your mind, especially the movement in your eyes. So it allows us for the client to feel empowered, and that you're going to be working through your own trauma. So you're going to be doing a lot of the work. So it allows the block that you've kind of placed on those traumatic events to be removed, so that you can reprocess those and start healing, from the start. So in phase 1, you're going to talk a little bit about history. Just a little bit about some of the distressing memories that have happened in the past, or some of the things that are kind of happening in the present. And so after these sessions are usually about 90 minutes. So it allows the EMDR facilitator to kind of just work with you and get comfortable with you. In phase 2, it's more about handling the emotional distress that's kind of happening within these memories. And then we're going to jump to phase 3 and 6. Phase 3 through 6 entails first a vivid visual memory image related to kind of the memory. Something that really that you can pick with that experience with your family and your father, possibly when your mom was abused and thrown into the fire. I know that you spoke that was really traumatic for you. Number 2, negative beliefs about yourself. So how does those feelings make you feel inside? 3, related emotions and sensory related to the body. So how are these memories and feelings making you feel inside your body? What is it triggering? And then identifies a positive belief going forward. So when we go to after this, you would be instructed to go back to a blank space. And then the facilitator kind of checks in with you, sees how things are kind of going, how you're feeling in the moment. And then we're going to go transition to phase 7. Phase 7 is the closure and kind of a closure of the session. And then I'll probably have you keep a log for the week and kind of see what feelings or things have come out since the session, and you'll check in with me the following week. And then phase 8 is going to be the examination of the process so far. So how have things going? How are you feeling? How are you feeling physically, emotionally, mentally? Just so we can have you working through the trauma and understanding kind of what the benefits of this reprocessing are. The goal is to produce a rapid and effective change for you as the client. You've been dealing with these really horrible traumatic events, and they've happened to you, over a long period of time. So it's going to take some work to kind of process through everything. But I want to let you know that EMDR has an extremely high success rate. Some sessions take only a few sessions. It just kind of depends on how much trauma. Because you do have several traumatic events that have happened to you, it may take a little bit longer, but I want you to understand that you're in a safe area, and I want you to understand that a lot of these traumatic events are what triggered your excessive drinking. And you are using that excessive drinking as a tool to kind of numb yourself and just kind of get away from those really negative feelings. So I want you to understand if you have any questions, and feel free to ask me at any time. But I want you to understand that we're here to help you and work through this traumatic experience for you. So what we'll do is we'll meet next week, and then we'll kind of start the process. Okay? Thank you. So that was my session with James, and processing EMDR through some of the traumas that he's had in his life. Thank you.